With hospitals taking in coronavirus patients, we've received calls asking if emergency rooms are still open to those with non-virus emergencies. News 5's Olivia Fecto spoke with a Cleveland Clinic doctor who says the answer is yes, but you really need to ask yourself, is it a true emergency?
Yeah, good evening, Rob. If you are in severe pain, doctors say you should still come to the emergency room right away, but other issues may be able to be resolved with a virtual visit.
It's important for people to know that the emergency departments are open 24/7, 365.
Dr. Baruch Fertel is the Director of Quality and Operations for the emergency departments in the Cleveland Clinic Health System. He says they're open for anyone having an emergency, no matter what.
As if you're having chest pain, if you're having severe abdominal pain or something like that, don't push it off until it becomes catastrophic.
But some people are concerned about coming to an emergency room and contracting COVID-19 from other patients. Fertel says the clinic is screening COVID patients and trying to keep them separated from others, using masks to limit the spread of the virus.
We're using appropriate PPE, we're using appropriate hygiene, and we're doing our best to expedite people's care in and out of the emergency department.
So what if you're having an issue, but it's not necessarily an emergency? A cough, nausea, a bruise or cut? Well, there's the option of a telemedicine or virtual visit.
If it's something that you're not sure about, or maybe it doesn't seem so serious, that's probably the perfect time to conduct a virtual visit, because in that case, they can help tell you if you need to go or not.
I started posting on social media that I would be happy to see people for urgent appointments for cuts and small burns and wounds.
Plastic surgeon Dr. Jennifer Greer is keeping her Menor office open, offering her services for people who may not need to go to the ER for minor injuries.
In a couple cases, it was something I could easily take care of in the office. A couple other cases didn't even need stitches, and I was just able to give them instructions on how to take care of the wound.
She's hoping to lessen the load for emergency departments. Either way, Dr. Fertel says emergency physicians are here to help anyone who needs to be seen.
We're here to evaluate people, we're here to treat, we're here to stabilize, we're here to take care of people.
And another thing to consider, hospitals are also limiting who can come into emergency rooms with patients. Rob?
Okay, what about those patients? Are doctors actually seeing a decline in emergency room visits because of the pandemic for things other than coronavirus?
Yeah, for the most part, Rob, the doctors said that they have seen fewer trauma patients, fewer people with cardiovascular type issues, because people aren't out and about as much. But there is one category where they are seeing, at least anecdotally, an uptick in patients, and that's people who have cut themselves on knives or other kitchen tools, or who have burned themselves because more people are cooking at home during this pandemic. Reporting live in Cuyahoga County, Olivia Fecto, News 5.